Did you know that surgeries used to be done without proper pain relief? Early anesthesia methods like ether and chloroform were groundbreaking at the time, but were far from perfect. Over the years, we've developed safer and more effective techniques, making surgeries much easier for patients and doctors alike. Anesthesia is essential because it keeps patients safe and comfortable during procedures, whether by numbing a specific area or by putting someone completely to sleep. In this video, we're going to explore the different types of anesthesia, how it works in the body, and some exciting new advancements like modern anesthetics that are making surgery safer and recovery faster. But first, let's break down the different types of anesthesia and how they're used in the human body. Let's start with the one most people think of when they hear anesthesia: general anesthesia. This is the type of anesthesia that puts you in a deep sleep-like state, so you won't feel any pain during your surgery as you'll be completely unconscious. General anesthesia is used for very invasive and major procedures, like surgeries to the head, heart, or abdomen. General anesthesia is administered in two ways. The first way is through intravenous therapy, which is the fancy term for IV. This is when a small needle is inserted into a vein on your hand or arm, allowing the anesthetics to flow directly into your bloodstream. The second way is through inhalation, where a mask is placed over your nose, allowing you to breathe in the anesthetic gas mixed with oxygen. Either way, once you're under general anesthesia, you're completely unconscious, meaning you won't feel, hear, or remember anything from the procedure. Now you might be wondering, what are the side effects associated with general anesthesia? Well, after waking up, you might feel fatigued, dizzy, or experience headaches and a sore throat if you had a breathing tube. Other common side effects include nausea and chills, but these usually go away within a few hours. Now, let's talk about local anesthesia. Unlike general anesthesia, this type of anesthesia only numbs a small area of your body while you stay fully awake. This is a great option for quick, minimally invasive procedures where full sedation isn't necessary. It works by blocking nerve signals in the treated area, preventing them from reaching the brain. Local anesthetics can be administered in three different forms, either injection, spray, or a topical cream or gel. Local anesthesia is frequently used in dental procedures such as filling cavities or removing wisdom teeth. It's also used for various skin procedures like mole removals, wart treatments, biopsies, and wound treatments like getting stitches. It's also used in some eye surgeries like cataract surgery. Most people tolerate local anesthesia well, but some may experience mild redness, itching, or a slight burning sensation at the application site. The last type of anesthesia is called regional anesthesia. Unlike local anesthesia, which numbs a small area of the body, regional anesthesia blocks sensation in a larger section of the body. There are three types of regional anesthesia: spinal anesthesia, epidural anesthesia, and peripheral nerve blocks. Spinal anesthesia involves injecting the anesthetic into your body's spinal fluid, creating a numbing effect that is often used for lower abdominal, pelvic, and leg surgeries. Epidural anesthesia, commonly used during childbirth, involves placing the anesthetic in the epidural space around the spinal cord to provide pain relief during labor. Peripheral nerve blocks target specific nerves outside the spinal cord to numb a specific part of the body, and they are commonly used for orthopedic surgeries. Some side effects of regional anesthesia include low blood pressure, headaches, and difficulty urinating. Now, let's take a closer look at the science behind anesthesia and what happens when it's administered. Anesthesia works by changing how nerves communicate, preventing the brain from processing pain and awareness. It does this by targeting two key systems in the nervous system. First, it targets GABA receptors, which play a key role in calming brain activity. GABA is an inhibitory neurotransmitter or chemical messenger that slows down nerve signals, helping the brain relax. Anesthesia enhances the effects of GABA, making it even more effective at reducing nerve activity, awareness, and sensation. It also targets NMDA receptors, which normally help transmit excitatory signals associated with pain and sensory information. Anesthesia blocks these receptors, preventing those signals from reaching the brain, which helps eliminate pain perception and awareness during surgery. However, anesthesia must be carefully monitored and adjusted, which is where the anesthesiologist comes in. The anesthesiologist plays a critical role during surgery. They're responsible for ensuring the patient's safety, comfort, and stability from the moment anesthesia is planned to the time the patient wakes up. Before surgery, they review the patient's medical history, check for allergies, and assess any potential risks. Based on this, they create a personalized anesthesia plan tailored to the patient's age, weight, and overall health status, as well as the type of procedure being performed. During surgery, the anesthesiologist continuously monitors vital signs like heart rate, blood pressure, oxygen saturation, and even brain activity. They adjust drug dosages in real time to maintain the right depth of anesthesia and address any complications immediately. You might be wondering just how safe modern anesthesia really is. A recent research study has shown that anesthesia has come a long way from its early risky days. In the past, anesthesia was considered highly dangerous, with significant risks and frequent complications. The use of substances like chloroform and ether pose serious dangers, with mortality rates as high as 1 in 2,000 for chloroform and 1 in 25,000 for ether. However, advances in medicine have drastically improved safety, making complex surgeries possible with minimal risk. By the late 1980s, anesthesia-related mortality had dropped to 0.4 per 100,000 procedures, and today fewer than one death occurs for every 200,000 to 300,000 anesthetic procedures performed. This remarkable progress is due to innovations in monitoring technology, refined anesthetic drugs, and stricter patient safety protocols, making anesthesia one of the safest aspects of modern medicine. Now, let's dive into the breakthroughs that have been reshaping anesthesia over the past several years. One major innovation is in brain monitoring. Instead of relying solely on indirect indicators like heart rate or blood pressure, modern EEG-based systems such as the bispectral index and patient state index provide real-time feedback on brain activity. This means that doctors can adjust drug dosages on the spot, ensuring patients get exactly the right amount of anesthesia. It's a game changer for reducing risks like being over or under sedated, and even helps prevent those rare moments when a patient might become aware during surgery. Another exciting development is how we deliver anesthesia. New closed-loop systems work like smart machines. They constantly check a patient's vital signs and automatically adjust the anesthesia dose during surgery. This helps make sure that the patient gets just the right amount of medication at all times. On top of these technological advances, we're also learning more about how each person responds to anesthetic drugs. Some researchers are studying how a person's genetics affect their reactions to these drugs. With this information, doctors can then tailor anesthetic plans to each individual, predicting and minimizing potential side effects in advance. And with the help of artificial intelligence analyzing patient data, drug dosages can be optimized even further, making anesthesia both safe and more effective. Ultimately, it's all about moving away from a one-size-fits-all approach and creating treatment plans that work best for each person. This blend of smart technology and personalized care is setting new standards in the operating room and paving the way for safer, more precise anesthesia. Now, while these advancements are incredibly exciting, there are still challenges we have to face. For example, rare complications like post-operative cognitive dysfunction still occur, and the high costs and limited access to these new technologies mean not every patient can benefit equally. And then there are the regulatory and clinical hurdles. Every new technology has to go through strict testing and approval before it can become part of everyday practice, which can slow down its adoption. All of this shows that even though the future of anesthesia is bright, there are still significant hurdles to overcome. Researchers are hard at work trying to tackle these issues and make these innovations accessible to everyone.